Now I'm going to switch to finishing aligners. I'll show you a few cases, and this is what I mentioned, that it would be great if you actually build this in the beginning of the treatment and be intentional about it. So here's a case that I'll show you. The patient started the treatment fixed appliances. This is around the COVID area at that time, and she broke a few brackets, and we got to the point that obviously this was not intentional. This was one of my earlier cases that I started using this finishing aligner protocols. So you can see that she had expander, fixed appliances, had phase 1 treatment. We did the phase 2. Phase 1 was done somewhere else. And then you can see when we get to the end, when I took those appliances off, I was not so happy about the, basically coupling of the anterior teeth, and the torque was an issue, and she broke this bracket, and this was like right in the middle of COVID. So I was like, let's remove everything. We had a little bit of a space between the 6 and 7, so we did all of that with aligners and carry over the treatment. And you can see, you can really detail the anterior teeth with aligners significantly faster. This is another example of a patient with a poor oral hygiene. He got to the point that you can see in here, we removed the fixed appliances. I still needed to do a little bit of a vertical correction and some degree of tipping on the upper anteriors. I have kind of mixed feeling about putting attachment for these finishing appliances. What I know is that there are certain movements that you can't get away with not putting attachment. So this was a case when I'm like, okay, we need to do extrusion and a lot of tipping, and I really need an attachment. So you can see 6 aligners on the top, 4 on the bottom, and we kind of carry him to the end. Not a lot of movement, kind of reasonable movement. You can see it on the table in here. And then when you look at the changes that we got like improvement in here. You can see pre-treatment was green. The white is post-treatment. We got a better coupling in here. You can see it here compared to the pre-treatment. And the patient is super happy. You can see the almost 1 month post-retention records. Again, I used Indoor 8.76 full-time. Everybody's happy. Everything looks good. So I really like these approaches to try to kind of move quickly to the end of the treatment. Here's another examples of finishing. This patient was about to move, so we're like, okay, let's just kind of carry your treatment over with the aligners. You can see the treatment plan outcome, 6 aligners top, 2 in the bottom. And you can see this is where he started with an expansion, fixed appliances. We took care of all those, and here's where he is. Suddenly started wearing really good rubber band, and I have a little overjet, minor spaces. This is a slam dunk with a liner to me, especially coupling that anterior teeth. And you can see after he was wearing those aligners, he was actually really, really good. You can see the mark in here, and you can see the improvement. The overjet, close the spaces. There's no detailing bend. You bend one side, the other side, become a problem. You have sometimes the brackets are on the way. You can't really close that overjet. Taking them off, and then using a few aligner, cleaning it is extremely good. One of the advantages that you have with uLab is that when you try to go through this process, you could scan the patient with brackets, remove them digitally using the uLab, or the aligners, place them in basically right when you remove the appliances, so there's no gap and there's extreme. The flow of this protocol is actually really good with the uLab software. Here are some records, and you can see in here, this is 15 months post-retention. There's a little bit of a tooth size discrepancy in here that you can see, even that the patient is almost class 1 in here, class 1 in the molars. You don't get a perfect coupling in here. But, when you think about where we started, this was the beginning. So I'm actually really happy about the outcome that we have for it.